here. So this is the front of the arm and forearm, and here is the back. You can see brachial plexus, branches from brachial plexus, leave them. Here is the artery. Okay. Here, which artery?
Axillary and teres major.
Yes, axillary and teres major. Where is teres major?
Here.
This is latissimus dorsi. Go after this. This is teres major. This is subscapularis. Okay? Subscapularis, latissimus dorsi, teres major. At this level. So this is the level for brachial. With me?
Yes.
So this is axillary. If I could find, this is axillary. If I could find the proximal end, which is between the sternoclavicular joint and the first rib, approximately this level. So this must be subclavian. So whatever you see here is axillary. After axillary, this is the level, teres major, latissimus dorsi here. Here, axillary. Then here, after this brachial, up till the level of head of radius. Sometime it may divide up in the arm, no problem. Sometimes. But the real site of division is here, and here you can see the brachial dividing into radial, here, and ulnar. This is the cut part of brachioradialis, you asked me here. Okay, so here is the brachioradialis tendon. After that, the radial artery is going here, straight down. Here you can see the superficial palmar branch. And you can find the artery going back into this depression, anatomical snuff box. You can find the artery. After this, it is going to again reach the first interosseous space, and from here, it must go deep down into the palmar surface. This is the end point of radial artery. This anatomical snuff box is the end point of radial artery. After that, it is going to appear on the palm. Let's follow the ulnar. Here is the ulnar artery. Ulnar. Ulnar. The ulnar is a superficial here, and it is making the superficial palmar arch. We cannot see the deep palmar arch here. Why? Because if we remove the structures, we may be able to find the deep artery, the deep part of the radial going from anatomical snuff box and first space into the palm, and we may see this. What we are seeing here, this is the superficial branch, palmar branch of radial, and this is of course going to make the arch with the ulnar artery itself. The deep branch of ulnar artery, which is going to make the deep palmar arch with the radial, is not visible here. Good? There is a profunda brachii artery. Profunda yani? Deep. That is seen in the radial groove with the radial nerve. So here you can see profunda brachii in the radial groove on the back. So the main brachial is going in front, giving you muscular branches for the front, and the profunda brachii is going on the back, giving you main branches to the muscles of back of the arm, like triceps group, extensors. Am I with you?
Can you point at that again?
Yes, here. See this one.
Okay.
Okay. This is anastomosis, some degree of anastomosis around shoulder, and you know the details. Any questions from here? No? These are the branches from superficial palmar arch. Of course, we have same branches from deep palmar arch, similar branches. And these meta will have anastomosis between. So, here is, just someone can make a hand here. Here is superficial palmar arch, deep palmar arch. And the metacarpals, they are fused. And then after they give the branches to the fingers. Thank you. Agree?
It's like 2 layers.
It's like 2 layers. And the deep tendons are the sandwich between the 2 layers. And these metacarpal will have anastomosis with the metacarpal of the deep one. Anastomosis with the deep one. Am I clear?
Yes.
Okay. Just keep it here. Some of the models, they don't show all the pathway, so we have to, yes, here you can see axillary, this one. It is being focused?
Yes.
Really? Okay. Then after that, here is the brachial. See, this is the brachial. After brachial, this is the radial. This is the ulnar. Good?
Yes.
And here you can see ulnar going to make a superficial palmar arch. Still I cannot see the deep palmar arch. Why? Because the radial. Now, this is a very beautiful division here. You can see the superficial palmar arch from radial. And you can see radial going back into the anatomical snuff box. Here. And after here, it must go deep. If we dissect more, it may be visible. Yes. Here. In the groove, you can see radial nerves, radial nerve and vessels. Profunda Brachii. Good? Just slip it down. This is again a good one. I took this picture in my lecture. Now, this is the one I give you the picture. So here. So this one. Bismillah. Can someone just lift it to show them?
This is what?
This is what? Good question. What do you think this is what?
Exactly.
Axillary.
Axillary.
After this level, this is axillary. So this is axillary. Good? Visible to everyone? Here, now, teres major, this may be the brachial. Maybe. Good? After that, here, we cannot see much of it in the, yes, in the hand, we can see some of it as some branches from the arch.
It's not clear in the form.
Not clear. Yes, not clear. We will not give you that which is not clear. The only way to ask in exam is name the artery which is not clear here. Okay? Name the artery which is not clear here. Give 3 branches. So the only way to ask is like this. Yes, here is the arterial part of axillary. This is the proximate level. After that, it must be continuing as brachial. Here, some remnants of the brachial. Here, it is connected to this one. Here is the division. And after that, again, the question comes like, this is a very beautiful thing here. You can see this is the brachial. Here it must divide into ulnar and radial. And here you can see a branch running on this interosseous membrane.
Doctor, how this is?
Dagiga. This is anterior interosseous. This is anterior interosseous artery. Yes, brother.
How this is brachial? A brachial should divide before.
Before, yes, in the middle cubital fossa.
Yes, yeah.
Yes, approximately. So here, this is not, I'm not very sure because the parts are separated from each other. That is the reason I told you. Here. So here is the anterior interosseous. A very beautiful thing here you can see, anterior interosseous. Good? This is the interosseous membrane here at this level.
Doctor, can we see the common interosseous before it's divided? Anterior, posterior?
I guess this may be the one, maybe, because you can see here, it is going the posterior interosseous.
Oh, yes.
This is anterior interosseous. You can see this one?
Yeah.
Anterior. You can see this posterior interosseous. Agree?
Yes.
What about radial and ulnar artery?
Not visible here. Name the arteries which are not visible. Give 3 branches. Okay? I have a hand here, another hand. Here, yes. This is a very beautiful hand showing you, we just removed the skin. Superficial fascia, this is the deep palmar aponeurosis. If I remove the palmar aponeurosis, okay, you can see a radial artery. Good?
Yes.
The artery is going into the snuff box. The superficial palmar arch is coming. Superficial palmar branch is coming here. The ulnar artery is going here. Let's see. Very beautiful. Okay. Superficial branch for radial and ulnar, making superficial palmar arch. Good? Just to make your life more easy, deep palmar arch. See here, superficial palmar arch made by superficial branch of radial and the main trunk of ulnar. Remove this, go deep. You will find the origin, the arrival of radial artery here, because from anatomical snuff box here is the radial, and radial is making the arch now with the deep branch of ulnar. Am I clear now?
Yes.
I hope this model stays with us until your exam. Here is which arch?
Superficial.
What is this?
لا superficial.
aponeurosis.
Palmar
Deep.
aponeurosis.
Superficial.
Superficial arch. Ulnar artery making superficial arch. Radial artery, I cannot see. Name the artery which is not visible.
Isn't this the one, doctor?
Here?
Here. This.
This one?
Hmm?
I think this is the.
Vein?
No, should not be vein. Muscle. Muscle. Okay. Yes. Inguinal ligament, anterior superior iliac spine, pubic tubercle. Good. Mid-inguinal point. Very clearly now you can see common iliac dividing into internal iliac, external iliac. Internal iliac you can see going in the pelvis and making superior, yes, gluteals here. They will have anastomosis with each other, plus they will have anastomosis of the 1-2 branches at least which are visible here, which are the among the 4 perforating branches of profunda. Let's see them one by one. Femoral artery, femoral triangle up till this level. Here, this is adductor canal, this is femoral artery, this is adductor canal, this is hiatus. Because after that you don't see the artery. So we must see the artery on the back. So here is the hiatus. Good? After hiatus you see the popliteal artery in the fossa. Then popliteal artery here will divide into posterior tibial here.
Popliteus muscle is not clear here, doctor.
This one. This one, popliteus muscle. This triangle. In front, anterior tibia will follow as dorsalis pedis. Deep, go down. Here, posterior tibial. Of course, you can see some part of peroneal. Okay, peroneal should come from here and is for the lateral or peroneal compartment, fibular compartment. Some books say here it must divide into medial and lateral, and the lateral will complete the arch. The medial will go like straight. We'll see some of them. Let's finish the plastic and then. So here is the anterior tibial, malleolus, medial, lateral malleolus, medial malleolus. This is the level. After that, dorsalis pedis. See here, dorsalis pedis going down inside. This is one of the digital branches, metatarsal branches. It will divide into digital. Okay. The dorsal arch is not very good here. I cannot appreciate. Some branches lateral tarsal may be here. Okay. Here anastomosis around the ankle. Here posterior tibial. just manage with this, and I will start with another one. Give me this. Okay, give me the big one first. Okay, inguinal ligament. Okay. Take your time, easy. See here. This one.
External.
External iliac, very good. Here femoral. This is the boundary. Here we can see some from internal iliac, some branch. Femoral. Profunda femoris is going on the lateral side, okay. So here is femoral. This is roughly the hiatus here. You may find hiatus on the back. No. So name the artery which is invisible here. This one. Thank you. See here. Yes. See the vein which is very clear here. Popliteal vein. The blue one. If you go deep, you are going to have the artery. This one, artery. This is the artery.
Popliteal.
Popliteal artery, popliteal vein. Go down. I think it's not. See 1, 2, 3. What is this? 1, 2, 3.
Tendons.
Still.
Tendons for the flexors or of the leg, of the soul.
Peroneal compartment.
Foot.
Peroneal compartment tendon. Yes. Any other idea?
Malleolus branches.
The main vessel with 2 veni committant. You know veni committant?
Yes. Yep.
This is vessel with 2 veni committant. Good?
Yes.
Enjoy your life. Dorsalis pedis is not visible. So the question will be, here is, yes, here is probably the, let us make it like this to make your, here is the medial plantar, here is the lateral plantar. And this is a variation where you find an arch made by medial plantar. Of course, dorsalis pedis must be here and it must join somewhere here. This is the reason for, this is the description for any variations.
Can I repeat in this, sir?
Here is the medial plantar. Here is the lateral plantar. Ideally, the lateral plantar should make an arch with the dorsalis pedis. But here you can see the arch is made by, so this is a normal, this may be a normal variation. The foot is done. Manage with the foot.
You didn't actually able to manage.
Okay, let's see if it's possible or not.